This month, we're going to discuss the knee joints. Today, we'll talk a little bit about the knee joint itself. The knee is the most complicated joint in the human body, so it's important to understand it well. Much like the elbow, the knee is a hinge joint. Also like the elbow, we often categorize it as simply a hinge, but in reality, it can rotate too. Without a little rotation in our knee, when we laterally or medially rotate our foot and turn the leg in or out, the entire leg would move as one, resulting in extreme lateral or medial rotation if we pointed our toes out towards one side or in towards the opposite foot. But because our knee does allow for some rotation, the thigh or femur bone doesn't have to rotate so much, depending on what we're doing. The knee can rotate, flex, and extend. Now this is the tricky part. Maybe it's just me, but it seems to get a little confusing in terms of flexion and extension when it comes to the knee, compared to joints like the hip. When we do a standing quad stretch, we are flexing the knee. We're bringing it towards the heel towards the glutes. When we extend the knees out and they're straight, they are in extension. For example, when we're in staff pose, the knee is extended. The knee joint we know is comprised of the femur or thigh bone and the lower leg bone or the tibia. The patella is the kneecap. The quadriceps muscle group comes together above the knee and forms the patellar tendon, and the kneecap is situated underneath this tendon. The patellar tendon connects to the tibia after it crosses the knee joint. Because kneecaps take a while I mean years to develop in children, they might not appear on a child's x-ray. That is just a tidbit I think is interesting, because if you look at an x-ray of an adult knee versus a child's knee, not only will the bones be smaller, you may not see a kneecap in a child's x-ray.